Sensory processing is a term that refers to the way the nervous system receives messages from the senses and turns them into appropriate motor and behavioral responses. We actually have 8 senses, not just the 5 that most people think of, which are touching, seeing, hearing, tasting, and smelling. We also have these 3 additional senses. Vestibular, which is our sense of balance and movement. Proprioception, which tells us where our body is in space. And interoception, which helps us understand internal body signals like hunger or emotions. Today we're focusing on the tactile system, or the sense of touch. This system helps us interpret things like texture, temperature, pressure, and pain, and plays a big role in how we interact with our environment. When a child has a well-regulated tactile system, they might notice touch, but they don't overreact to it. Their brain responds appropriately to sensory input. They're typically not bothered by things like tags or light touch, and they probably are not overly ticklish. Some children, however, are tactile over-responsive. Sometimes we call them tactile defensive. This means their nervous system reacts too strongly to touch, and they might prefer deep pressure instead of light touch. They might feel overwhelmed in crowded environments. Light touch might trigger strong emotional reactions, and everyday tasks like grooming can lead to meltdowns. You might also see a fight or flight response to typical sensations or even behaviors like toe walking. These children might try to rub off a spot that somebody touched. They'll probably fidget with their clothing or avoid certain clothing. They might avoid messy play, like using sand trays or playing in dirt or slime or shaving cream. They also might be particular about their clothing and become very upset if their clothes get dirty or wet. These children might be a picky eater, which can be related to tactile sensitivities in their mouth. On the other hand, some children are tactile under-responsive or input-seeking. This means they don't register touch strongly enough and they seek out more input. They probably will touch everything they see. They might have a high pain tolerance. They might appear to play rough with others. They might not even recognize their own strength. Sometimes they engage in self-injurious behaviors like biting themselves or pinching or hitting themselves to get more input. These children might not notice light touch, temperature changes, or even injuries like cuts or scrapes. They might sit on things or step on things without even seeming to notice, and might not notice a runny nose or a messy face. You also might see them covering themselves in sensory materials like lotion or shaving cream or paint. So these are some things we can do to help children with tactile over and under responsivity. No matter the subtype, there are some strategies that can help all children. The first thing is stay calm yourself. Children will internalize our anxieties, and you can't help them regulate if you're not regulated yourself. Second, keep track of the trigger behaviors and what can calm them. That way you know in the future what will help. And most importantly, incorporate heavy work activities. Heavy work involves activities that push or pull against the body and provide input to muscles and joints. This type of input is very organizing and can help children feel more regulated and focused. Some examples include things like erasing whiteboards, catching balls, squeezing objects, sitting in a beanbag chair, blowing bubbles, using Play-Doh, cutting thick paper, doing animal walks, and cleaning tables. These are just a few of the many heavy work activities you can have them do. For children who are over-responsive, we want to include heavy work regularly throughout the day. It's also important to provide a calm space that they can go to when they feel overstimulated. You can remove irritants like clothing tags and choose more comfortable fabrics for them. Another thing you can do in the school environment is do a simple thing like have the student line up at the end of the line so that they don't have to have too much contact with the other students. You can modify art activities, such as starting with less tactile input and gradually increase exposure as they're able to tolerate it. For example, if you're doing finger painting and you know your student cannot stand finger painting because of that messy thing on their hands, you can have them use a cotton ball instead of using their finger to touch the paint. For children who are under-responsive, remember these are the kids who are seeking this tactile sense, we also use heavy work, but we pair it with more intense sensory input. We can provide some sensory-rich seating options, such as an air cushion, an elastic band around their chair legs or table legs. Sometimes we can use sensory toys with a lot of input, things like koosh balls and bumpy balls, Velcro strips on their desk. We want to encourage activities that provide strong input and even movement, like spinning or rotary movement, which can help alert their sensory system. Thank you so much for your time and attention. Hopefully this gives you a better understanding of how the sense of touch impacts behavior, and it also gives you some practical ways to support children with different sensory needs.